June is Pride Month. It's a time to celebrate, love, and lift one another up. This includes raising awareness. This morning we are talking about specific guidelines for breast cancer screenings for transgender patients. Joining us this morning is Dr. Dianne Johnson, the Director of Breast Imaging at Memorial Hospital. Thank you so much for coming on.
Thank you for having me.
You know, this is a really great conversation to have, very relevant during Pride Month. So often we see breast cancer awareness campaigns directed toward women. Not very often do we see these campaigns reaching out to folks within the transgender community.
That's right, and the transgender community faces many barriers, especially when it comes to health care. That's why it's so important for our transgender patients to understand what the screening recommendations are, and it's also important for our referring physicians to know the special considerations that may apply to this community.
When we were talking about educating the community, what should transgender people know about screenings?
So just a little bit before we get started so there's no confusion. When I say transgender men, I'm referring to those people that were assigned female at birth but now identify as male.
Correct.
When I say transgender female, I'm referring to those patients that were assigned male at birth and now identify as female. And so for our transgender female patients, the screening recommendations are really based on two factors, and that's age and hormone status. So for those patients that have elected to take hormones, once they've been on hormones for 5 or more years, we recommend screening with mammography every 1 to 2 years, beginning at age 50. So of course that's a little bit of a different recommendation than what people are used to hearing. For our transgender male patients, so those are patients that were assigned female at birth but now identify as male, their recommendations are really based on age and breast tissue. So in those patients that have their breast tissue, the screening recommendations are the same as for the ones that you're used to hearing. Annual mammography beginning at age 40. But if the patient has had all or most of their breast tissue removed, they usually don't need screening. There are a few cases where we would consider it, but those would really be handled on a case-by-case basis, working with the patient and his healthcare provider.
How do you go about having these conversations at times, difficult circumstances? How do you go about having these conversations with your patients?
Well, I just think it's important to make sure that these patients understand their risk, understand, that this is an evolving area of research, that these recommendations are likely to change as more research is published. And just like with anybody, it's so important for all of us to know what the recommendations are that apply to us, also to know what our individual risk is. And risk assessment can be performed at a breast center. It can also just be performed in the healthcare provider's office.
And that all, though, starts at home with yourself, having that conversation with you or your loved one.
That's right. Having that information, you can be an advocate for your own health care, and that's important for all of us. I also want to say, it's also important for anyone that has a specific breast problem, meaning a lump, skin changes, armpit swelling, anything like that.
Men or women.
Men or women, doesn't matter, for literally everyone. It's important to see your physician very promptly, get those problems evaluated. I also like to remind everybody that to support breast health and overall health, it's important to eat a healthy diet full of fruits, vegetables, whole grains, and legumes, exercise, get plenty of sleep, avoid tobacco and use of risky substances.
Breast cancer does not discriminate. For more information, where can people go?
Talk to your healthcare provider, and it's also, you can go to any breast center that would be happy to discuss your individual risk and recommendations.
Dr. Johnson, thank you so much for coming in this morning.
Thank you.
We appreciate it.